some of your questions. Many of these questions from the asthma forums that I've gathered. People have asked me. So also, I'm giving a talk on February 12th. February 12th. Please put CNY. That's for Chinese New Year. CNY at the comment section below, and I will give you invites to my talk on February 12th. So let's get started. Let's take a look at this week's interesting questions. All right, first question is from Jemlin, who asks, is COVID vaccine okay for children with asthma and allergies? Well, Jemlin, thank you for this question. You know, actually, there were two other questions. Magbigay lang sila ng mga ibang mga, may mga, ages lang na binanggit. Isa was 5 years old, isa was 9. But basically, it's the same question. Okay ba ang COVID vaccine for children with asthma and allergies? Now, ang first question ko sa inyo, Jemlin, and for everybody else who's asking this question, ano bang ibig sabihin ng okay? You know, meron tayong palabas na naging very popular, and this popular show was called It's Okay to Be Not Okay. Tama ba? Korean eh. So, it's okay not to be okay. And basically, this is now the question, ano bang ibig sabihin na okay? Okay lang ba sa'yo na ganito? Okay lang bang ganyan? Diba? So, medyo mahirap yung tanong na sagutin yung ano ba ang kung okay ba, kasi ang tanong is ano bang ibig sabihin na okay. So yeah, so I'll let you know what it means to be safe in terms of the clinical trials that have been done on the on the vaccine. So yeah, so first, before any drug is approved, it has to go through multiple phases of trials. Yan, phase 1, phase 2, phase 3, and it has to be approved by the FDA, and then meron ka pang phase 4 na ifa-follow up. Now, this one ensures moderate or pretty much more safe, no? Medyo safe na yan pag dumating sa phase 4 na approved na, you know. Ang problem ng yung ating vaccines ngayon for COVID, because it was a worldwide pandemic and the demand for this was really very strong. People were clamoring for it. Medyo napaikli itong mga phases na to. So, yung FDA approval ngayon, right now, is not really an FDA approval per se. It is an FDA approval for emergency use. So, yun siya. So, hindi siya full FDA approval. So, that's the first thing, concept natin. Now, the other one is you have to understand what safety means in terms of any medical program, no? Safety basically doesn't mean na walang pwedeng mangyari sa anak mo if you're given this product. Walang pwedeng masamang mangyari. Basically, safety means na when we gave this particular drug, vaccine, testing, whatever, to a certain number of people, no, yung nagkaroon ng adverse side effects is below or within a certain number. Anong ibig sabihin nito? Out of 100,000, kung sabihin natin, magsiset yung FDA or yung drug company ng certain number, o sige, I'm going to say a number, magbigay tayo ng number, 100. Okay. Out of 10,000 people na binigyan nila nito, kung less than 100 or below ang nagkaroon ng certain set of adverse reactions, then they will say, oh, safe na yan kasi pumasok siya within our parameters. Hindi siya ibig sabihin na zero, walang nangyari. It just falls within a certain parameter that they fall into safety, that they will define as safety. Ngayon, so that's how they define it. So, is it okay? We cannot really predict it. No, we can only look at the data and say, so far sa data, wala naman namatay nung binigyan, gano'n, no? Or yung mga may asthma, wala naman nangyaring very untoward sa kanila nung binigyan. So, basically, doon tayo nagbe-base kung okay nga or hindi, or yung at least as far as the clinical data is concerned. And so far ang may asthma and for allergies, hindi pa naman siya basis to not give the vaccines. Ang mangyari nito is if you have asthma or allergies, the vaccine center will take additional precautions for you. No, like for instance, after ka bigyan, instead of papauwiin ka kaagad, obserbahan ka muna ng mas matagal. Ganyan. Also, if you have if there are vaccines that have non-egg components to it, and then if they ask you, do you have an allergy to egg, tapos chinek mo yung yes, you might undergo, mas matagal kang babantayan muna before ka makuha. And then sometimes, they will also prepare, sometimes for allergy or asthma. So, if you will take these vaccines, you have to be prepared with your medication for asthma or allergies. No, so if most people na walang asthma, walang allergies, they will just be prepared with, let's say, medicine for the usual side effects, which is pain relievers, ganyan. Pero if you have asthma or allergies, you have to be prepared for your asthma and allergy medications also. No, so there is no guarantee na walang mangyayari if you're given this. But so far in the trials, wala pa naman sobrang pangit nangyari. So hindi siya contraindication. Ang asthma and allergies is not a contraindication for vaccination at the moment. Given the current data that we have. So I hope I've answered your question, no? But again, it's not a guarantee na walang pwedeng mangyari sa anak mo porque sa trials mukha naman walang nangyari, mukhang safe siya. Pwedeng may mangyari, but you just have to be prepared also if you want to take if you're going to take this, you have to be prepared. You have to prepare your medications ahead of time and you have to declare it doon sa vaccine center. They will take some additional precautions for your child when they give the COVID vaccine. Okay, so this is the first question. Thank you, Jemilyn. From Andy, she is asking, how do we know the difference of cough of COVID or not? Well, Andy, unang-una, ang cough of COVID happens kung may COVID ka. So, first of all, you have to find out, COVID ba yan or hindi? So, ang COVID, you will be able to know this by having a swab test. So you have a swab test. Ang pinaka ina-accept natin na standard is yung PCR-RT swab test. Okay, may kamahalan nga lang yun and sometimes it takes you 24 hours or at the height of Omicron exposure, mas longer than 24 hours. Umabot ng 3 days, 4 days bago lumalabas yung results. We do have a new kind of test now. This is the Laminar flow test. Antigen test kits. This is a new technology. Alam mo, nung estudyante ako, there was no technology like this. It was before yung mga passive, yung mga rapid tests, they were all mostly ELISA principle. This one is the laminar flow technology, and this is itong mga swab test din siya, pwede sa nasal, pwede sa throat, and then you just have to follow. In fact, I have one here. Yan. I have one here. Yan, para siyang para lang siyang pregnancy test. And then you test this out and yun, it will help you determine whether positive or negative. However, unlike other screening tests, no? Kasi ang screening test works like this Ang other screening test is kapag nag-positive ka, you will go to the confirmatory. Anong ibig sabihin? Pag nagpa-pregnancy test ka, nag-positive yung pregnancy test mo, anong next step? Mag-ultrasound ka to make sure na talagang pregnant ka, di ba? Ganon. Kung nagpa-HIV test ka, lumabas kang positive the next one will be confirmatory test, no? Kung mag-positive. Pag negative, we don't go to the confirmatory. Etong mga laminar flow test, medyo baliktad yung principle. Pag nag-positive ka, we stop there and we presume it's COVID. Pag nag-negative, we do the RT-PCR. So magka-RT-PCR ka pa rin, no? Pero anyway, if you do have no symptoms, wala kang ibang symptoms ng COVID, let's say wala kang fever, wala ka naman yung mga joint pains, number one, then there's a smaller chance na COVID siya. Kasi yung COVID usually may fever, no? Pero meron kasing COVID yun na asymptomatic, nagpa-positive lang sa mga test. Positive sa test, kaya maka-quarantine natin o ma-isolate, no? Ngayon, the other one is, do you have history of cough? That will explain this cough. Like, parati ka bang may GERD? Dati ka na bang may gastroesophageal reflux disease? O dati ka na bang may asthma? O then, that compounds it na there's now another possibility na baka hindi nga siya COVID because we have another item that can partially explain it. So kung mag-negative ka sa mga test for COVID and you have another alternative explanation like GERD or asthma na you frequently have this, then there's a bigger chance na baka nga yun yung cause, yung alternative explanation natin rather than COVID. But if you've never had these types of cough, you've never had them, and then you're having fever, you're having the other symptoms of COVID, yung joint pains, fever, and then nagpa-test ka nag-positive, and then you have a very big possibility na yes, COVID nga siguro talaga ang cause niyan. The other one is we have this thing called long COVID. These are cases na magkaka-COVID ka and then after you recover from COVID, tuloy-tuloy yung cough mo. Yes, that's long COVID. By the way, for long COVID, I have people who have recovered from this using exercises and all this. So let me know if you know anyone with long COVID now. So, thank you, Andy, for this question. I think she has a follow-up question. Ano ba to? Yan, from Catrice. How will I know if my asthma anak ko or allergy lang? Okay, for number one, magmasasabi lang yan is your doctor, no? Legally, only your doctor is allowed to give a diagnosis, whether asthma yan or allergy. But I'm going to give you some hints on how your doctors, how we doctors are able to sort of figure out, baka nga asthma to or not. So the first one is we're going to ask you a question of kailan ang cough niya ba katulad ng yung cough na may hika, na may asthma. So usually pag may asthma, may phlegm yan. O, kung dry na dry yung cough mo, pwede pa rin. Pero minsan kasi mga bata, they don't know how to expectorate. No? So yeah, number two, meron bang yung nagtitrigger ng asthma? Meron mga specific things trigger asthma in the environment, and ito rin ba yung nagtitrigger ng asthma or ng ubo ng anak mo? Then that adds to the possibility na baka nga asthma siya, no? Another one is yung anak mo ba ay may family history ba kayo ng asthma? Yung tatay nyo, tito nyo, no? People who are close to in your family, meron bang close relatives, no? And I'm not talking about friends or neighbors. I'm talking about relatives. Father, mother, uncles, lolo, lola, meron bang may family history ng asthma? Kasi if they have, lumalaki yung possibility na asthma to. Ganun. So, kung wala kang family history to, malamang allergy lang ngayon. Ngayon, yung question mo, yung allergy kasi medyo iba din yung cough niyan eh. But there is another one, no? There are more. Another clue is yung presence of wheezes. Wheezes is something we listen to the back, no, with our stethoscope. Nako, wala yung stethoscope ko dito. So we're going to put on a stethoscope. We will listen to the back of your child. Pag naririnig namin, may characteristic sound na ang tawag is wheezes, no? Then mas malaki yung possibility na asthma to. Lumalaki yung possibility. In fact, it jumps up pag wheezes. Talagang it's a very big possibility, no? Now, if you don't know what wheezes sound like, you can type it in YouTube, and marami tayong mga videos na maririnig what wheezes sound like. Ngayon, if you are having asthma, if you are somebody who grew up with asthma like me, we know what it sounds like even without a stethoscope. Kasi every time we get asthma, we can actually hear it in our own body. No need for stethoscope, no? So, yan, no? So, yung wheezes adds to your possibility na asthma siya. Ngayon, kung hindi wheezes ang naririnig, may tinatawag tayong crackles, baka hindi asthma yan. Or baka asthma yan with another problem. So, yeah, number 3, yung physical exam. Is it consistent with asthma? And one of the major things that we look for in the physical exam is yung stethoscope, papakinggan yung likod, no? And another one is, meron bang ibang explanation para sa ubo niya? So, this one, if, let's say, in-x-ray yung anak mo, and then lumabas na pneumonia, may talagang pneumonia sa x-ray, kitang-kita, and then, baka it's not asthma, it's pneumonia. O baka it's pneumonia with asthma. Or baka naman, nung Covet test, positive. So, baka COVID yung nagkakos, not asthma, no? So, we have to look at it, may ibang explanation ba sa ubo other than asthma? Kasi if there are other explanations, and the other explanations are more likely than asthma, then chances are baka yun yung explanation that we will be taking. Pero kung it really looks like asthma, walang ibang explanation, then talagang malaki yung asthma will be on your top of your list. Yan. And there is another one, the last one, number 5, no? O nga pala, so this one, dito pumapasok yung mga laboratory tests. We do other laboratory tests to just check out kung hindi nga talaga asthma yan. Baka ibang sakit yan. Okay. Lastly, gumagaling ba siya sa gamot para sa asthma? Kasi kung asthma yan, and you give medicine for asthma, dapat nare-relieve yung ubo. Dapat nare-relieve siya. Di ba? So, yan yung last. So, then yung we will test this. There's actually a test called the salbutamol stress test. Ipapabigay natin siya ng gamot for asthma. Kung lumuluwag yung hinga niya, lumalaki yung possibility na asthma nga talaga yan. Ngayon, kung hindi lumuluwag yung paghinga, hindi gumaganda, baka hindi yan asthma kasi hindi tumatalab yung gamot for asthma. So, this one, sino nagtanong nito? Si Andy. Yeah. So, the question here is, paano ba, how will I know if may asthma anak ko or allergy lang? Well, so yon, you will know if your doctor tells you na it's asthma. And it's not just plain allergy. And your doctor will go through the ropes of what I told you. Yung history mo, titignan niya, is it consistent with asthma? Titignan niya yung physical exam ng anak mo, yung papakinggan yung likod, is it like asthma ba? Is there any other, they'll do laboratory test, they'll do whatever test they like, and then check nga ba, is there any other explanation other than asthma? Okay, and lastly, ite-testing yan sa gamot. Kung kumatalab yung gamot, then malaki yung chance na asthma talaga yan. Okay, so I hope I answered your question. Let's go. Andy has asked another question. Andy asks, Doctor, I'm planning to adopt or care a pet dog, but my son has rheumatoid arthritis and both has asthma, occasional attacks. Do you advise us to adopt a dog? Now, first of all, Andy, this year kasi, 2022, is a very special year. This year, ang dogs, there are a lot of people like dogs, like pets, no? But 2022 is a very special year. I'm gonna tell you, wag kang mag-adopt ng dog. Mag-adopt ka na lang ng tiger kasi year of the tiger ngayon. No. But kidding aside, no? Kidding aside. Dogs have a lot of advantages and responsibilities that come with them, no? So, kung nakita nyo, may viral video ngayon na yung isang German Shepherd biglang inatake yung poodle, kawawa naman yung poodle, kawawa yung owner ng poodle. These are responsibilities that you and your children will have to deal with when you have dogs. Papakainin nyo yan, and all that. And this can teach your children responsibility. Aside from the other, there are people have shown, studies have shown with animals, nagiging less lonely yung mga tao. There are some advantages to them, no? So, you may want to go for these advantages. Ngayon, for the rheumatoid arthritis and the asthma, first, ang problem natin with rheumatoid arthritis is we don't really know what causes rheumatoid arthritis. We know that it is a autoimmune disorder, meaning your body's own cells are attacking itself. Parang yung bagama sa military, friendly fire. Yung mga military who are supposed to defend you, ina-atake ka. Is ikaw mismo. So, that's the problem. And because hindi pa well-known or well-established yung cause ng rheumatoid arthritis, we cannot categorically say na taking a dog or not will affect your problem with rheumatoid arthritis. However, dogs can have tendencies to cause or trigger asthma attacks. Tama po kayo dyan. So, number one, there are some dogs that are hypoallergenic. There are some dogs now that are known to be hypoallergenic. You may want to look them up. Number two, you will have to deal with yung mga chemicals that you're using with the dog, like yung shampoo ng dog, yung mga ibang mga binibigyan niya sa dog. Then they should be hypoallergenic to prevent you from catching asthma. But sometimes even with all of these, pwede talaga mag-trigger ng asthma ang pet. So there is a way that I know that you can actually stop the asthma, or you can actually control asthma even if you're having pets. And the best way to know to get this is I will introduce you to a dog lover. She's a dog lover. She loves her pets, and she had repeated asthma, and her doctor told her, you have to part ways with your dog kasi ina-asthma ka ng ina-asthma. So what she did, she discovered a technique that was able to stop her asthma, and now she doesn't have to give up her dogs. And this is Miss let me see, sana ba yan? Yan. Si Miss Ellie Abella, she is the founder of Biohacking Philippines, and the technique that she found that was able to stop her asthma without having her to give up her pets is called the Buteyko method. And here she writes this down. Buteyko method cured my childhood asthma and severe childhood allergy to dog dander. Yan. I can now kiss and hug my dogs without anaphylaxis, without asthma medicine. This was in 2014 and it hasn't changed. So, there are other things you can do aside from giving up your dogs. And one of them is to take up the Buteyko method. If you are interested in the Buteyko method, I am giving a talk on February 12. No, I'm going to tell you guys how you can stop asthma and bring out the tiger in you. Type CNY at the comment section below, and I will tell you more about this amazing world-renowned technique. No, so type CNY at the comment section below, and I will see you. Okay, from RDC Deyang. Doc, why po every time i-open ang aircon parang magkaka-colds na ang bata? Pag naman i-off, mawawala agad. Okay, RDC Deyang, first of all, do you know na first ang problem natin is indoors, mas grabe ang pollution indoors than outdoors. Bakit ganoon? Kala ko ba outdoors 'di ba, yung 'di ba? For instance, tingnan natin tong Covet. Saan ba mas stricto sila when it comes to the vaccinated, unvaccinated na tong sinasabi na ganyan? Mas strict ang government sa indoors, 'di ba? Yung indoors kasi sa indoors mas kumakalat ang mga staff kasi hindi talaga nakakaikot, no? Number two, pag inon mo yung aircon, kung ano yung dust na nandiyan sa room mo, gagalaw. Maboblow yan ng blower, iikot yan. So, mas worse yan kung madumi yung aircon mo. Kung maraming dust na nakadikit sa aircon mo, talagang ikakalat yan. Meron nga kaming nangyari noon, dati, meron pala sa likod ng aircon namin, merong puno na nakadikit doon, may mga langgam na dumikit sa aircon. Nung inon namin yung aircon, lumipad yung mga langgam all over the room. No? So, ganyan siya. Pag inon may aircon, bubuga yan. Kung anong dust ang nasa loob ng aircon, kakalat yan. So, you have to keep cleaning your aircon. Number two, ipapaikutin ng aircon yung hangin. So, kung meron kang mga dust dyan, mga other stuff that triggers asthma, iikot yan. And number three, ang aircon, papalamigin ang kwarto mo. Pag lumamig ang kwarto mo, you will have what we call, one of the things which are what we call non-specific triggers. Ang mga non-specific triggers, included dito ang cold environment, exercise, and stress. Hindi pa well-explained ng Western medicine kung bakit yung mga tao nagkakaroon ng allergies, sinisipon, nag-ina-asthma, kapag lumalayo to, hindi ko man lang alam kung anong nangyari sa'yo. For instance, sasabihin mo, safe ba ang gamot? Sabihin ko, eto yung gamot na safe, yung pala allergic ka doon. Malay ko ba? I haven't seen you. I haven't talked to you. I haven't even seen you. But I'm just going to give you some general guidelines, no? Number one, yes, ang nebulization is considered safe for many things, no? So ano ba yung nebulization? For our audience, ganito po ang nebulizer. Ang ginagawa ng nebulizer, it pumps air into a tube. Tapos yung air na yon, papasok siya sa isang capsule na lalagyan ng gamot. Yung air, yung gamot na nilalagay mo doon will become a mist. It will become aerosolized. And you can inhale it ngayon. So yung aerosol na yan, yung gamot, diretso yan sa baga, sa lungs. And that will exert the effort, yung gamot, doon diretso yan sa lungs. This is why actually, when it comes to medicines, the nebulization is considered quite safe for its use, no? What do I mean quite safe? Pag nag-tape ka ng gamot, yung gamot na yan, matutunaw yan sa tiyan, pupunta yung gamot na yan sa iba't ibang parte ng katawan mo, including doon sa fetus. Pero pag ninebulize mo, diretso yung gamot sa lungs. Hindi na yan pupunta sa tiyan, hindi na siya sa digestion system. So, in general, mas safe ang mga nebulized na gamot kaysa sa mga non-nebulized, provided na tama yung gamot mo is not harmful, and provided also na yung sakit mo, it's in the lungs, no? So, yan yung nebulization. Ngayon, ang problem natin with nebulization, is it safe for the people around you? Yan, repeat ko, is it safe for the people around you? Even before COVID, we were already questioning this kasi marami mga health workers na na-expose dun sa gamot ng nebulization and nakukuha nila yung side effect ng gamot na yan. So kung everyday ka, parang kang nag-a-assist sa nebulization, you start to absorb itong nebulization, and it can lead you to some of the side effects ng gamot na yan. Palpitations, mamanid yung kamay, yung mga ganyang klaseng side effects. And yes, meron daw inihika because of some of the side effects. So, kung tama yung gamot mo, even if tama yung gamot mo and yung gamot mo is already approved for pregnancy, so for asthma, ang number one na ang pinaka-popular and pinaka-common na gamot for asthma na nebulize for pregnant women is salbutamol. Salbutamol is a bronchodilator. It will open up dito. Walang steroids that can affect your baby, and it's one of the oldest drugs developed in 1975. Imagine, mas matanda sa akin. 1975 dinevelop ang salbutamol. Ngayon, when it comes to pregnancy, we tend to lean on the older medicines. Bakit? Kasi kapag mas matanda yung medicine, mas alam na natin na mas marami na siyang nagamitan na tao. So, mas alam na natin yung side effects na ilan yung tinatamaan, ilan gano'n. That's why, when it comes to pregnant women, yung salbutamol is usually yung ina-accept as more or less yung pinaka-safe. But again, I haven't met you, so I cannot categorically safe na, safe to sa'yo. Hindi. I'm just giving a general idea na ito usually yung pinaka-common na binibigay, no? So, Kung asthma yung gamot mo and you're nebulizing with salbutamol, it's generally regarded as the safest one, no? And then you have to have the correct dosing. Correct dosing, so you must be supervised by your health practitioner, your doctor. Now, even if a medicine is considered safe, it's been tried, you've been using it na nga, even if you've been using it and it's safe for you, you have to continuously observe for unwanted effects. Kasi anytime, pwede magkaroon ng problem. Anong ibig sabihin nito? Number one, yung gamot mo, ngayon, uso maraming fake na gamot, o baka fake na gamot na bili mo. O, you don't know. Even yung mga magagandang brands, minsan nahahaluan yung stock, no? You don't know. No? Number two, pwede kang mag-develop ng allergy to any substance at any time. Anytime. Okay. So you have to keep observing for unwanted effects and you have to assess and reassess yourself. Is the medicine still effective? Okay ba yung gamot? You have to keep reassessing. No? Ngayon, yung controversy with the aerosol, I mentioned before na even before COVID, yung aerosol, na maraming na-expose sa aerosol na yan, meron tayo problem kung may COVID yung nag-nebulize. If may COVID yung nag-nebulize, you will potentially make the virus airborne and you will aerosolize the virus. That's why in the start of the pandemic, a lot of the hospitals in Metro Manila have stopped using the nebulizer in the hospital kasi na-expose yung staff, kumakalat talaga yung virus. No? So this is a tragedy kasi the nebulization is quite effective. Very effective siya for the medicine to reach the lungs kasi unlike the inhaler, kailangan ba may timing eh. Kailangan mo i-timing, kailangan may konting training. Ang nebulization wala, sasaksak mo lang yan, lagay mo sa mouth, and then let the person breathe. So, ang problem ng timing, if you are, nagpapanik ka na, hindi ka makahinga, hindi ka makapag-isip, medyo mahirap yung i-timing yon, no? Tapos kung hindi ka pa marunong, first time mo gumamit, medyo mahirap yon. And then the other one, minsan medyo pangit yung lasa ng ganyan. Pag na-spray yan diretso sa throat mo, use of the medicines, no? You could reduce the medicine use for pregnant women. So if you're worried about is medicine safe for you, what medicine is safe for you, well, what you need to do is one of the things that I would advise you to do is take up the Buteco method. It has saved me a lot of personally for my own asthma and the people I've taught it to also. So I'm Dr. Charles Edward Florendo, and I want to thank you for attending this live talk again. And meron pa ba akong ibang slides dito? Tingnan natin. Ayun! Yes, ano ba yung Buteco method? Yes, the Buteco method is taught in the breathing camp workshop that I have curated for you guys. The breathing camp is one of the best ways to learn the Buteco method, no? And the Buteco method is a world renowned technique that will teach you how to listen to your body. It will give you a system, the way for you to listen to your body and to respond to it. The Buteco method can help you with your asthma, with your allergies, and it can help you stop asthma to bring out the tiger in you. So, I would like you to please write CNY down below the comments for your invites, and looking forward to seeing you very soon. So, Kung Hei Fat Choi, Happy Chinese New Year.